So Molly and I will introduce ourselves first, and then we will go through some slides, and then we'll hopefully have a lot of time for questions in the end. But jump in, let us know if you can't see something or audio is off or anything like that. But my name is Amy Lyle, and I am a social worker. I'm the hub team social worker for Echo Autism Wisconsin, and I will let Molly introduce herself.
I'm Molly Neff. I am the parent on the HUP team for our Echo Autism project. I also am a nurse by background, but that's just by happenstance. I'm the parent.
Molly's being so modest because her nursing background comes in handy all the time. We are so glad to have Molly on our team. And actually, Molly facilitates our Echo sessions, which is fantastic. She is such a wonderful host, and I love that we have parent leadership front and center on our team. It's really important to us. So Echo Autism Wisconsin, we provide consultation and learning to primary care providers across the state and now a little bit in Northern Illinois, given UW Health's partnership with Swedish American Hospital. So in case you're not familiar with the Echo model or just need a refresher, we're going to play a little video because it just describes the overall model, which can be used in many different ways, including outside of medicine as well. So I think we'll just go ahead and play that, and then we'll go from there.
We're going to try to play it. Oh no.
It will work, I think, if you keep clicking on it.
If you keep just...
Because I had a hard time starting it too. But maybe something needs to be enabled or... And if it's not going to work, that's okay. We'll just skip it.
Yeah, I'm not even seeing the play button. Trust us, it was cute.
That's all right. Moving on. So Echo is a model that actually started in New Mexico as a way to get care for patients with hepatitis. There were patients across the state who were dying because they were on long waiting lists to be seen by the specialists at the major medical centers. And so this was the brainchild of a physician who just couldn't stand for that to be happening anymore. And so he developed this hub and spoke model, which is core to Echo and what we do in Echo. The Echo Hub team are sort of the content experts, if you will. That includes Molly as a parent representative, myself as social worker. We have Katie Kastner, developmental pediatrician, Martha Walters, a psychologist, are all part of our hub team. And so we make up the hub team, and then the spokes are the participants in the Echo sessions. So they are primary care providers across the state. It is primarily primary care providers in terms of pediatricians. We also have family practice docs. We also have a couple of participants from birth to 3 actually this go round. And I think we have 23 registrants this time. So we feel like we're finally getting really rolling with our Echo. So I think that's what I want to say about that. Yeah, thanks, Molly. Okay, so the Echo model is an ABCD model, and it uses these core concepts in order to disseminate knowledge and information, but it is also an all teach, all learn model. So we are learning just as much from the spokes who are out in the field treating their patients and learning from families about their unique challenges and experiences. And they are hopefully learning from us too about experience and expertise that we've gained working where we do in our specialty clinics, and we work on disseminating best practices in treating children with autism in a primary care setting. So how do we do that? The A is about amplification. So we are using technology to leverage scarce resources. And what's kind of funny now is that this was, we used something called Zoom, which was relatively new, when Echo was first being developed. So people had to be trained in how to use Zoom, and it was very different and new. And it's kind of mind-boggling the way everyone knows about Zoom now, but that's really it was a more unique modality when it started. So that is how we're taking scarce resources and spreading them out through use of technology. B is for the best practices, and that's we're using best practices to reduce the health disparities that we know are out there across the board in terms of many different aspects in terms of disability, but also race and ethnicity, rural versus urban, like SES, lots of pieces to that. So we're sharing those best practices in that way so that the knowledge can be out in the community where people are, where kids are being cared for in their home communities. We use, this is my favorite part of the ECHO model, is case-based learning to master complexity. So we don't use any PHI in our cases. It's all been de-identified, but the way it works is that spokes bring cases from their practice and present them to the ECHO team. And we learn from each other and we make recommendations for each other in terms of what answers to questions the spoke might be looking for, what they can take back to the family, next steps, things like that. So that is absolutely my favorite part of ECHO. The discussion is so rich, and we're able to get into a lot of complexity actually in these cases in the discussion. And we take turns basically giving that. So somebody will present a case, and then the spokes will all ask follow-up questions, and then the hub asks follow-up questions. And then we go to the spokes for recommendations, and then the hub gives recommendations. So that is part of the richness of the learning experience for all of us too, that we're all participating in that way as well. And then the D stands for web-based database to monitor outcomes. So we gather a lot of information with the help of Nicole, who is our data expert. We do pre and post tests of all spoke participants. And then we also send out surveys for each ECHO session that we do. And we are gathering all that data, and it eventually ends up in the big ECHO database that I believe lives in New Mexico. But it's pretty amazing if you go to the main ECHO website to see really the spread of knowledge and how far out it goes from the different hubs. And so that's how it's used, is to measure what they call the ECHO effect. So how far is our reach? What are we doing? And we're really trying to measure what we're doing. So how does it work? I think I may have already said some of this already, but it is through technology enabled, collaborative learning. ECHO creates access to high quality specialty care in local communities. So we all know the very long waits at Wasteman Center and other specialty locations. And that's one of the reasons why we wanted to get into this work, is to try to reduce some of that wait time and really have needs that are able to be met in local communities, have people be able, have providers feel more comfortable caring for the kids with autism that we know are in their practices, and to have a way to get consultation while growing in expertise in caring for these kids. So what we do, sorry, Molly, you don't have to go back. Okay. Well, so we have an online video conference every other week on Thursdays from 12 to 1:30, where we all meet together with our hub team and our spokes. We first have about a 20-minute didactic on a special topic that Molly's going to talk a little bit more about, what topics that we get into. That lasts about 20 to 30 minutes. And then we go into the case presentation and consultation aspect of it. We do record the didactics, so those are available to all spokes And I believe they're also going to be going on our website if they haven't already, but we don't record the case discussion just to create that safety and community, and also to protect PHI. Next slide, please. Thank you. It's your turn, Molly.
Oh, I'm on. All right. So why do we do it on autism specifically? As we all know, there's an increasing prevalence in autism. And this is 2018 information, so it's even going up since then. But our ultimate goals in the project of Echo Autism is to increase autism awareness, increase the appropriate referrals, increase the ability for providers to answer questions for parents that are seeking help, and increase the assistance that we can get to the children that need this help. There's few treatment options, as we know. There's few trained professionals, and there's really long wait lists at the specialty centers. I used to quote some old evidence, and thankfully somebody just last year did a newer systematic review of literature out there on studies as it relates to healthcare providers and their comfort level and their level of expertise as it relates to managing people on the autism spectrum. And so over half of primary care providers worldwide that are polled on their comfort level describe themselves as uncomfortable or slightly uncomfortable managing people with autism. And furthermore, 79% of those describe treating autistic individuals as difficult or very difficult. So as you can understand, that's very challenging. When they did pre and post tests about knowledge and information as it related to their understanding of how to manage comorbid conditions and autism in general, the results were very low across the board, but results significantly increased in those providers that had access to autism-specific learning opportunities. And that's exactly what we're hoping to provide here. So our objectives as they relate to managing primary care providers and now additional staff is to increase their self-efficacy with identification of autism symptoms in children between 12 months and 18 years of age, and then increase their self-efficacy in assessing and treating common medical and psychiatric comorbid conditions. So exactly those gaps in knowledge and awareness that we were talking about with worldwide leaders that have been polled that are primary care providers and their comfort levels. So what's been our progress so far? We launched our first 6-month session on July 30th of 2021. And the different didactics that we teach throughout the course, what is autism, going over the DSM-5 criteria, screening and next steps, how to get referrals, how to appropriately screen, what screening tools are available, what to do when they age out of those screening tools, supporting families, how to manage the grief cycle, how to talk to families, how to meet every family member where their needs are. Medical follow-up, genetic evaluation. We do get into some content about additional diagnostic testing that may need to be done, or working up other comorbid conditions. Community resources. We talk about all of Amy's amazing resources that she knows about and has access to, getting people on board with Children's Long-Term Support Waiver, how to find additional information. Treatment options. And I see our presenters for treatment options on this call as well. Going over ABA, what it is, where it's provided, and definitely a discussion of the potential family burdens on those as well. And then we go into some comorbid conditions that are commonly affect families on the autism spectrum. So we have a feeding and constipation discussion, ADHD, sleep, anxiety, and then a general discussion about irritability, and a large safety presentation that I kind of go through a little fast from time to time. But we are now on our 4th session. We began with Madison-based only providers on that July 30th, 2021. And we've expanded not only through the state, but now, as Amy mentioned, we have progressed into Northern Illinois as well. So we're quickly spreading throughout as many people as we can reach with this.
And actually, we started in 2020, Molly.
2020? Oh my gosh. I was going to say it felt like yesterday.
Well, the years are all blending together, as we all know. And, it was like such a, it was a complicated time to launch, like 7 times, a few months into the
remember
pandemic.
it.
But
I can't even believe that's actually accurate. I'm checking my records as we speak. But no, Amy's absolutely right. It was July of 2020 that we started. So this is our hub team now. As Amy mentioned, that's the singular focus here at the Wiseman Center. and then branching out to those spokes. So we have Katie is on the call. Katie Kastner is our developmental behavioral pediatrician and our physician lead. Martha Walters on for psychology. We have Amy as our social worker. I'm on as the parent. And then we brought Gina on as well from psychiatry. It's a fantastic team. And we wanted to get through this quickly because we knew that there's going to be some questions. I'm going to go back to any of the screens that you want more information on, but we wanted to hear from you of what you want to learn about echo autism.
And thanks for mentioning Gina too. I knew I was leaving somebody out when I was listing everybody. Gina's just officially joined our hub team, and we're so grateful. Whew, it's great to have psychiatry on board. And feel free to put questions in the chat or unmute and ask your questions. We can also just kind of just chat a little bit more. We started off with, I would say, 2 very involved, regularly attending every single time pediatricians in July of 2020. So we started off really tiny and just kind of kept moving forward as the world was adjusting to the pandemic. And, you know, it's everyone's familiar with Zoom now. Everybody has the technology to participate in Zoom now. So there have been some unexpected, challenges launching during a pandemic, but also everyone is so much more familiar with technology and teleconsultation and things like that, that it's been a mix of experiences, and definitely not anything anyone would have predicted, of course.
I'm glad you mentioned that too. One of the things we should have put on this progress slide, and if we ever do this again, I'm going to definitely put it on there, is not only have we had progress with moving on to our 4th session and truly expanding our groups, but as I look at this list of all of our topic areas, one of the other important things that we've been instrumental in doing is creating and developing tools for primary care to assist with this. We've created algorithms based off of our original ECHO sessions, linked to a clinical practice guideline that we as a team did together too. And so we're really going beyond that initial just presenting to those folks that are able to come onto Zoom with us, but creating tools to get out to the community as well.
Well, and when Molly says we, it was a huge lift on her part to create these tools. And that was done in a lot of it was in partnership with our previous developmental pediatrician, Danielle Schulze, who I know you all were familiar with, and now Katie Kastner. So I just want to give credit where credit is due.
What kind of questions do you have for what this project looks like? Or
Gail put a question in the chat that I can read out. Perfect. So she says, I'm wondering whether you're hearing about other learning needs participants have, for example, topics not included on this list that matter a lot to them when caring for children with ASD. Yeah, Molly, do you want to take that first? I'm going to have to pause and think about it for a second.
To be honest, no, I have not heard any additional feedback that we are missing the ball on some of these. Again, this is primary care. I know that there has been some discussion in the past that there was a request for additional content as it related to imaging. And that was part of our making an algorithm that addressed imaging. And that we added that small amount of content into our medical follow-up and genetic evaluation. It was touched upon because we don't encourage across the board imaging, but what we need to do is really spell it out a little bit more clearly that we don't, and the rationale behind it. And then I know that as of late, we have gotten a lot of questions as to our theories on why autism, where it comes from and who's to blame besides the moms. And so I think that was the one that we've not gone there yet. And, we're happy to have offline discussions with people about current studies and participation in those studies. But at this point in time, we haven't made a whole new topic about it.
Yeah, if you all have any ideas about that, that would be wonderful to hear. And I think the way it ends up kind of happening is through our case-based discussions. Lots of other topics get brought up, or nuances or aspects of topics that we just dive into in the moment. So while we don't necessarily have a didactic on it, we end up talking about lots of different things that go beyond these topics. But I see Erin, you have your hand raised.
Yes, I appreciated Molly's comment about how the moms are to blame. So but so that distracted me. But my question is about, do you have providers who have participated more than once? Are you doing any kind of longitudinal follow-up around like kind of like sense of self-efficacy, or what are you doing to kind of see, has the needle moved, so to speak?
We have not had people participate in the Zoom sessions a second time. But one of our first of the 2 pediatricians that Amy was referencing that were heavily involved did actually help facilitate the approval process for our clinical practice guideline and their subsequent tools. And so she was able to weigh in and provide to every chief in the hospital her experience with autism and what impact it made for her. And she could attest that these tools were going to be incredibly helpful for other primary care providers. So there was some feedback in that, I've seen this before. This helps me at the bedside, continue that care that I've learned.
And I know Nicole may be able to speak to this, not to put you on the spot, Nicole, but we do ask questions about efficacy and self-efficacy. So we do have data about that. I don't have it to share right now. Gina also started as a spoke, and then we recruited her to be a hub team member. So we have had that, and then we've also, this is kind of going off topic a little bit, but we have had registrants who heard about ECHO from other participants. We've had learners like medical residents who are with some of the spoke members like join for sessions, which we love. So yeah, there's just a side note.
Thank you. That's helpful to think about, though, just in how we structure things, how we refer people that way. So thanks.
Also, a lot of work on behalf of Libby Halati, who I want to give a shout out to in terms of recruitment. So she has been persistent and really tracks who we're reaching out to for recruitment, and it has paid off in the end. And I don't know if we have data about how people are learning about it so that they register or anything like that. But we couldn't do it without Nicole and Libby and all of the work that they put in to help us be able to show up and have the sessions.
Do we know whether other states running echoes are seeing decline in participation? I know anecdotally, I don't have the data on it, that when I meet with the other groups, Missouri runs a lot of their content through there, that they have experienced a lot of decrease. And the interesting thing is that we started all of ours during COVID, so we don't have any pre-COVID to relate it to. So what we've seen is exponential growth. And that's really, I don't know if that's like post-COVID and everybody's starting to come out of it, or if we would have seen that other decline that other groups were having. But I did hear from groups that started pre-COVID, there was a significant downward. I have not heard that they have the upward trend. Amy, have you heard that at all?
I haven't, but I haven't checked in about it. But I know even one of our initial spokes, there were redeployments happening right across pediatrics. Clinics were being repurposed to serve certain patient populations. Just everything was so up in the air. I don't think providers felt like they could register with any confidence and know that they were going to be able to participate. So I think as everyone has adjusted to this as much as we can to this new normal, and that people have maybe felt more confident in their ability to participate.
I'll be honest, the one weird thing COVID did for us is that the timing was so fantastic that we were able to offer, mostly in the supporting parents and the anxiety content, though, very specific to the pandemic content as it related to COVID and COVID regressions and things that PCPs were hearing and trying to deal with in their new telehealth world as it related to families as they dealt with keeping their kids home and how to manage that. And it was amazing. And we wouldn't have had that opportunity or that experience to give them in time content as it related to COVID. Those poor providers too, man. I don't know how they did it without us. I mean, thank God they had us.
These are great questions. Does anybody else have any questions or thoughts? Or, there are many other applications, as I said, for ECHO. There's a whole education model that I know our AAC program at Weissman Center utilizes. So it's only continuing to grow. And another benefit of the pandemic is that now, ECHO immersion training is available online, which it used to have to, it was that you had to go in person and have the whole experience, which I was lucky enough to get to do that, but that's also a barrier for a lot of people, including parents. So I'm hoping that this also helps to grow ECHO as well as it becomes more accessible, just in terms of receiving the training.